My name is Tzvi. I'm a board-certified plastic surgeon. I've been practicing plastic surgery in Bergen County for 20 years. Breast implant removal surgery is a procedure performed when a woman, for one reason or another, wants her implants removed. That may be because she doesn't like the appearance of her breasts and she wants a revision. It may be because her implants are in so long that there may be an issue with the implants and she wants to remove. Or there are patients who are concerned because they had previously placed textured implants and want them removed or exchanged. There's several reasons why a woman may request her implants to be removed. There are aesthetic reasons, and then more reasons related to oncologic reasons. Some people may have had their cosmetic implants placed in 20 years ago, 15 years ago, 10 years ago, or more recently, they just don't like the way they look. And those situations will remove the implant, revise the breast augmentation, and place in new implants. Other reasons why patients may want their implants removed is because of a concern of breast implant-associated anaplastic large cell lymphoma. Now, this is a very rare and highly treatable lymphoma, not breast cancer, that's associated with implants that have been in the patient for greater than 10 years typically. It's only been sewn with textured implants. It's very rare and highly treatable. But there are women who have these textured implants and that are just generally concerned about having them in place. The FDA does not recommend them to be removed, just to have careful monitoring. But if there is any pain, change in shape or hardness, that's a reason to have the implant removed. Another reason is an even more unusual and rare tumor called squamous cell cancer, which is related in a very rare amount of patients with implants that have been in greater than 25 years. That's a more aggressive tumor, and in that situation there's typically change in the breast shape, hardness, and we remove the breast in its entirety with its capsule. For patients with textured implants where there's a concern of anaplastic large cell lymphoma or squamous cell carcinoma, the procedure is more aggressive. In that situation, we perform what's called an en bloc capsulectomy, where we remove the entire implant along with the white capsule that's around it. And we do that to remove everything associated with the implant. For an anesthetic patient undergoing breast implant removal, we can do several things. We can exchange the implant for a new implant, or we can remove the implant and either perform a mastopexy, which is a breast lift, or no procedure if she doesn't seek any other options. For patients undergoing what we call an en bloc capsulectomy, where we remove the entire implant with its capsule because of a concern of anaplastic large cell lymphoma or squamous cell carcinoma, typically no other aesthetic procedure is done at the same time. Rather, remove the implant and let the patient go on to a recovery. For aesthetic patients undergoing implant removal, depending on what she chose afterwards, whether a new implant being placed or a mastopexy or a breast lift or no procedure besides having the implant removed, the recovery is quite straightforward without any significant morbidity or recovery afterwards, because we anesthetize the chest for 3 days and the patients really require just Tylenol or Motrin. For patients who underwent an implant removal with an en bloc capsulectomy for an oncologic reasons, or they were concerned about their textured implant, the recovery is rather straightforward. We anesthetize their chest and they go on to their routine pretty rapidly. There are many patients who have textured implants who are concerned about breast implant-associated illness or anaplastic large cell lymphoma or squamous cell carcinoma, things that they've read about in the press. These are extremely rare diseases. Breast implant-associated illness is a confluence of symptoms that patients claim they have after having breast augmentation surgery, including weakness, hair loss, a lot of somatic complaints that they think are related to their implants. They've gone to their rheumatologist, their primary care doctor, their neurologist, and it's a diagnosis of exclusion when everything has been already ruled out. And those patients, and in my over 20-year career I've had maybe 2 or 3, at that point we'll perform an en bloc capsulectomy, remove the entire implant and the capsule, and hope that those removal of the implant and capsule improves their symptoms.